Today we'll be talking about irritable bowel syndrome and how a low FODMAP diet can positively affect it. Our first question was, what are FODMAPs and how do they interact with the gastrointestinal tract? FODMAPs are classified as a group of carbohydrates that are known for triggering digestive and gastrointestinal symptoms. They are poorly absorbed in the small intestine and are osmotically active. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Oligosaccharides are the saccharide polymers, and food examples include onions, leeks, and asparagus. Disaccharides include sucrose and lactose, and food examples are cow's milk and yogurt. Monosaccharides are the monomers glucose and fructose, and examples include apples, honey, and peaches. Polyols are small-chain carbohydrates, and food examples include blackberries and lychee. Irritable bowel syndrome is a chronic disorder of the gastrointestinal tract. The most common symptoms of IBS include abdominal pain, cramping, bloating, and noticeable changes in the bowel movements. There are many causes, such as diet, the nervous system, severe infection, and changes in the gut microbiome. It negatively affects the general quality of life. There are 3 types of IBS: constipation, diarrhea, and mixed. There is no clear reason why IBS exists, and as such, there is no real cure to this chronic disease. FODMAP foods cannot be easily digested through the small intestine easily due to the fact that they are osmotically active. Once in the large intestine, these foods are fermented by the microbes and colon bacteria. This process causes gas to be released into the large intestine. This ultimately bothers the individual with IBS and causes symptoms of IBS to be prolonged or increased in intensity. When these foods get digested with people with IBS, it can trigger an inflammatory response and their bodies do not adjust well to it. For example, an investigation was made on the effects of a diet low in FODMAP foods compared to an Australian diet in a randomized controlled trial. Participants were assigned to groups that received 21 days of a diet low in FODMAP foods or a normal Australian diet. Participants who went through with the diet low in low FODMAP foods had a lower overall gastrointestinal symptom scores than those that went through the Australian diet. Another study was done where 75 patients were randomly assigned to 2 separate groups. There was one group with a diet that is typically recommended for patients with IBS, and the other group ate a diet low in FODMAP foods. The results of that study were that both diets reduce IBS symptoms, thus combining both diets would likely produce a greater and more positive effect. The first step to implementing a FODMAP diet is to eliminate all FODMAPs from the current diet for 4 to 8 weeks. This is so the body can adjust to digesting without these foods. The second step is to gradually introduce these foods back into the diet. For example, the patient would only include oligosaccharides back into the diet for a week or so and would keep track of any symptoms. They would move on to disaccharides and so on and so forth. Once they completed all groups, the third and final step would to keep what bothers the patient out of their diet and allow what they can tolerate back into the diet. Low FODMAP is a diet, but not to the extent that other diets are. It is more of a lifestyle change because every person with IBS has different food triggers. A low FODMAP diet is not an elimination diet. Although there is still no certain or correct way to treat IBS, reducing the severity of the symptoms can certainly be done in different ways. Along with the usual recommended diet for patients with IBS, reducing the intake of FODMAP foods has been proven to also lessen the symptoms of the disorder and alter the health of those patients to great effect.